that we're seeing the first major world pandemic of most of our lifetimes, what can we do in the interim to be prepared for the next one?
I think that's a good question, and I think so. First of all, I mean, I am a big fan of how we start to look at the fourth industrial revolution for healthcare, anyhow. But I think, especially as we think about another pandemic, and when I talk about that, I'm talking about AI, 5G, robotics, genomics. So I've tried to think about moving from everybody talks about the Internet of Things. I think in healthcare will be the Internet of You. And the reason I think that's so important, we've been working with some companies on wearables. So theoretically, that shirt you're wearing would send continuous data about your heartbeat, about your respiratory rate, about your temperature, around a lot of other things, about your sleep patterns, that would be filtered. And if you were having some premature ventricular contractions or some atrial fibrillation, or your temperature went up, we know that. So theoretically, in a non-pandemic world, if you got up in the morning and let's say you had asthma, and you got to your Alexa and said, "I want to hear the daily podcast," it would say, "Well, before we do that, your respirations were a little labored. Take an extra inhaler, and then I'll play the daily podcast for you." That future is not far off. Now, if you think about what that would mean to a pandemic, first of all, we know where the hotspots are, literally, because we can see is there a certain area where temperatures are rising or where respirations are. We would know our employees that were at risk for the same reason. So there would be an automatic thing. If you're one of my employees and your temperature's going up more than a degree and a half in 24 hours, you'll just get an automatic chatbot of, don't come to work today.
Hmm.
So I think that those kind of things will start to make a difference. The second thing is that I think as we do more telehealth, etc., you'll have less people depending on the traditional healthcare ecosystem. So I'll give you an example. I'm working with a company called Nuvo. That I'm an obstetrician. So if you think about the way things are in pregnancy, if you need to be monitored 3 times a week, you're going to the hospital to get monitored 3 times a week. Now, obviously, you can't do that during COVID. This company actually creates, sort of monitors you can take it home with you with AI that can help you evaluate. I think post-COVID, 25-year-old women that are pregnant are going to say, "Wait a second, you want me to get in my car, drive to your hospital in downtown Philadelphia 3 times a week, pay $35 to park, go to a place with a lot of sick people, get on the elevator, go to this little sort of ER type room, get a monitor that other people have used attached to me, so that 2 hours later, some nurse can tell me that it's okay, when I know that I can, use Nuvo and do that at home while I'm watching Tiger King. Like, why am I doing that? So I think you'll start to see, a lot of this technology make it less of a, oh my God, what do we do? Because much less will have to be in the hospital. I'll give you an example. 30 years ago, maybe before you were born, but 30 years ago, we would have been talking a lot about Fridays in banking during this pandemic, because there were lines out the door of people wanting to deposit checks and take cash out, on a Friday, because that was the day the bank was open late. Through this entire pandemic, has anybody talked about banks? No. Why? And by the way, we don't talk about telebanking. My guess is if you deposited a check this morning, Grant, you didn't say, "I think I'll telebank this morning."
Yeah.
It's just that banking has moved from 90% of being in the bank to 90% being at home. And that's why it's not a problem during the pandemic. Again, I think you'll see a lot of that happen through the fourth industrial revolution in healthcare.
I've definitely seen a lot of friends I know who have used telehealth during this time have said it was totally intuitive, way easier than having gone in, that sort of thing.
Yep, absolutely. Absolutely.
So, the last thing I want to ask you is just whether you have any closing thoughts for clinicians working in infectious diseases at this time. If you have anything you wanted to mention about Jefferson Health's efforts right now that we didn't cover, just going to open the floor.
Yeah. So first of all, for obviously, since so many of your listeners and folks that are involved in Contagion Live are ID professionals, I just want to say thank you. I think the amount of ingenuity, the amount of dedication and commitment of our infectious disease doctors, nurses, and everybody else involved has just been unbelievable throughout this. So the first is thank you. Um, I think from a Jefferson point of view, look, I think everybody talks about the healthcare heroes on the front line. I think it's important to recognize certainly the doctors, certainly the nurses, but there are a lot of folks that work at Jefferson and every health system that literally, like I said, come in and clean the floors or go in and have the patients feel better. Or you can imagine hospice in this kind of situation, and the importance of self awareness and empathy just can't be overstated. I think the other thing that I've been passionate about and Jefferson's been a leader on is recognizing we talked a lot about technology, Grant, but then we have to think about what's the role of the human in the middle. And I think one of the things that needs a real disruption, not just tweaking, is the fact that as AI and some other things happen, we need to start to select doctors and nurses very differently. We've selected doctors to be better robots than the robots. Like how can you memorize the Krebs cycle better than I can? Well, that's not going to be the criteria for success in the future. In fact, knowing the answers won't be the criteria of success because they're all on Google. It's going to be knowing the right questions to ask. It's going to be able to be a human, be self-aware, empathetic. So in our medical school, we have the third oldest and third largest medical school in the country. We've really been concentrating on holistic admission criteria, a more diverse class, et cetera. So I guess what Jefferson has believed in for a long time and has been a leader in is it's time for a disruption in healthcare. It's time to literally start to think about how different sectors and creative partnerships can change healthcare. If anything comes out of this COVID-19 tragedy, hopefully us double downing on that disruption will be a positive. Jefferson will be at a lead in that. The most exciting thing I was doing pre-COVID, which will be the most exciting thing I'm doing post-COVID, is working with a large VC in Palo Alto, working together, not having them create a product, having us buy it, but having the traditional healthcare ecosystem and the Silicon Valley entrepreneurs actually work together. So to me, that's where Jefferson's been a leader. That's where healthcare with no address makes sense. That's why I think we weren't as scared, if you will, about the pandemic. We were ready for some of this stuff, and I'm just humbled by the commitment, dedication, excellence of the ID professionals at Jefferson, beyond the collaboration among the systems in Philadelphia, people on the front lines, and also my senior team and board of trustees that have just all gotten together and said, "Let's do the right thing."
That's great. And as you sort of mentioned in the beginning, it's everybody from the ID specialist to the sanitation worker who really is that essential worker that we hear so much about.
Yep. Look. Everybody. The one thing we all share, doesn't matter your gender, race, etc., is we all want to be able to thrive without health getting in the way. I mean, and my goal is to have a system that's less sick care and more, how do we assure people that they have that health? And again, I'm hoping that we get to a point where we're really going after those social determinants of health so that people are healthier. So if there is another pandemic, we're not sitting here saying that African American folks in underserved areas or Latino folks have a higher death rate in this pandemic because of all the concomitant and other complications that they have.
Right. I mean, those things that I've brought this up in a few interviews now. There is this sort of distinction we make between crisis disease and background disease. But what
Right.
we're finding out is that a lot of the stuff that's kind of built into what's considered the social cost on a kind of daily basis, outside of a pandemic, a lot of that stuff matters during a pandemic, stuff like diabetes and other
Yeah.
underlying health conditions.
Yeah. I mean, yeah. If you're obese and smoke, um, um, and you end up on a ventilator, you're going to die during this pandemic. Or you have a much greater chance of dying if you're on a ventilator. We've started to do some statistics on that. And obviously age matters. So there's nothing you can do about that. But if you're over 65 and you're obese and you're diabetic and obese and a smoker, you know, probably 2/3 of the folks don't get off the ventilator. If you're healthy, you're fit, etc., it might be the exact opposite. So it really is life and death. I think the more we can do to recognize and understand why there's a higher rate of obesity in certain zip codes, why there's a higher rate of diabetes, why there's a higher rate of cigarette smoking, and do something about it, and not say it's not my problem. If you're a hospital system or you're an insurer, then we won't have that 10 years from now, 15 years from now in the next pandemic.
Thank you very much for joining me today. Really appreciate all your insights, and would love to have you back sometime.
Sure, Grant. Thanks for getting the word out and Contagion Live. Talk to you soon.